All right, let's talk about beta blockers. They're a class of drugs that you've probably heard of, but maybe you don't really know what they do. We're going to demystify how they work, and more importantly, we're going to spotlight the 5 key situations where they can actually be pretty dangerous.
You know, if you've ever felt a little bit lost in all the pharmacology jargon, you are definitely not alone. It can seem super complex, but I promise you, by the end of this, you'll see how all the pieces connect in a way that just makes sense.
So what is a beta blocker at its absolute core? Well, it's a drug that basically gets in the way of adrenaline. Think of adrenaline as your body's go, go, go signal, especially for your heart. Beta blockers step in and pretty much tell that signal, hey, not so fast.
And here's exactly how they pull that off. Imagine your heart has these little docking stations, or receptors. Adrenaline wants to dock there to rev things up, but the beta blocker gets there first and takes up the parking spot. With the spot taken, adrenaline can't dock. The result? The heart doesn't get that go signal. It just chills out. It beats slower and with less force, which in turn brings your blood pressure down. Simple, right? But really effective.
So, because they have this calming effect on the heart, it's really no surprise that beta blockers are absolute workhorse drugs. They're used for some of the most common heart-related conditions out there, from managing day-to-day high blood pressure to protecting the heart after a major event like a heart attack.
Okay, now this next point is absolutely crucial. You have to understand that not all beta blockers are created equal. Some, like propranolol, are what we call non-selective. Think of them like a shotgun. They block the beta-1 receptors in the heart, sure, but they also block beta-2 receptors found elsewhere, like in your lungs. Then you have the cardioselective ones, like atenolol. These are more like a sniper rifle. They primarily target the beta-1 receptors in the heart. This distinction right here is the key to understanding all the risks we're about to talk about.
I mean, they lower blood pressure, they protect the heart. Sounds pretty fantastic, doesn't it? But, like with any powerful tool, there's always a catch. The very thing that makes them so incredibly helpful is also what can make them harmful if you use them in the wrong situation.
And that brings us to the main event, the 5 big dangers. Let's break down the specific conditions where using these drugs requires extreme caution or is just a flat-out bad idea.
First one up on the list, patients who have respiratory conditions like asthma or COPD. And this goes right back to that last slide we saw about the 2 different types of receptors.
So here's the problem. Remember how we said non-selective beta blockers hit everything, including those beta-2 receptors? Well, the beta-2 receptors in your lungs are responsible for keeping your airways nice and open. So if you block them, the airways can clamp down. This can trigger a full-blown asthma attack or make breathing way, way worse for someone with COPD. It's a direct and potentially very dangerous side effect.
Okay, danger number 2 is severe bradycardia. That's just the medical term for a very, very slow heart rate. This one is just pure logic, right? The drug's entire job is to slow the heart down. So if a patient's heart is already beating too slowly to begin with, adding a beta blocker on top of that can push their heart rate into a dangerously low zone. It's kind of like slamming on the brakes in a car that's already rolling to a stop. Our third danger is a condition called a heart block. Now, this isn't a physical blockage like a clogged pipe. It's actually a problem with the heart's electrical wiring, the system that coordinates every single heartbeat. See, beta blockers naturally slow down that electrical signal as it passes through a critical junction in the heart called the AV node. So in someone who already has a signal delay, what we call a 2nd or 3rd degree heart block, the drug can make it so much worse. You could basically cause a complete communication breakdown between the heart's upper and lower chambers.
All right, our 4th danger zone is acute heart failure. This is when the heart muscle is suddenly weak and is really struggling to pump enough blood to the rest of the body.
Beta blockers, by their very nature, reduce the force of the heart's contractions. Now, while that can be a good thing for a stable heart long-term, giving one to a heart that is actively failing is like asking a runner who is already exhausted to slow down even more. It tanks their cardiac output right when the body desperately needs it.
And finally, our 5th point. This one isn't an absolute no-go, but it's a very serious use with caution. And this involves patients with diabetes. Now, what's happening here is really subtle, but it's so important. When someone with diabetes has low blood sugar, their body's alarm system kicks in and releases adrenaline. This causes those classic warning signs: a racing heart, shakiness, tremors. But what do beta blockers do?
They block adrenaline, so the drug can literally hide those critical warning signs. A person might not even realize their blood sugar has dropped to a dangerous level until it's way too late.
So, to pull it all together, here is your cheat sheet. The 5 big dangers to always remember are respiratory diseases like asthma, an already super slow heart rate, serious electrical heart blocks, acute or uncontrolled heart failure, and the fact that they can hide low blood sugar in patients with diabetes.
And that's really the ultimate takeaway here. You see, each of these dangers isn't just some random rule you have to memorize. It is a direct, logical consequence of how the drug works. Once you really get that core mechanism, that beta blockers slow the heart by blocking adrenaline, all the other pieces just fall right into place. The important question isn't just what the dangers are, it's why they exist.